Good day, ma'am. I am student nurse Mariel of BSN 1G. Today, I'll be performing the general survey. So, the purpose of this activity is that the assessment will be completed without the patient experiencing anxiety or discomfort. The findings are documented and the appropriate referral is made to other healthcare professional as needed for further evaluation. So, first, we are going to perform hand hygiene and wear our PPE to prevent the spread of microorganisms. After that, we are going to identify the patient so that the right patient receives the right intervention. Can I check your wristband, ma'am? Can you state your name?
Salcedo.
When is your birthday?
September 27, 2008.
What is your age?
14.
Okay. So after that, we are going to provide the patient their privacy by closing the doors and curtains of the room. So after this, we are going to explain the procedure to the patient so that the patient won't get confused and to facilitate cooperation. Now, today we are going to conduct a survey to collect information regarding your health and such as your height, weight, your BMI, your anything, and your behavior. Is it okay with you, ma'am?
Yes.
Okay, so first, for the assessment, we are going to assess the physical appearance of the patient. So, as I can see, my patient appears to be his or her age. She looks like a 14 years old. As I can see, my patient's mental status is alert, oriented. She responds to my questions and she responds appropriately. So, ma'am, can you lower your face mask for the meantime? Okay. As I can see, my patient's facial features are symmetrical, and however, she shows acute distress, such as she looks like she's in pain, and she looks like she is anxious. So, after assessing the physical appearance, we are going to assess the body structure of the patient. So, we are going to assess the height and weight, the distribution of body fat, the proportion of her body features, body parts, and her posture. So as I can see, my patient's height looks appropriate for her age and her genetic heritage. Her weight is appropriate for her height and build. Her fat is evenly distributed, and her limbs and body features are proportionate to each other. And lastly, her posture, however, is not erect. It is quite slouching. So after assessing the body structure, we are going to assess their mobility. So, ma'am, can you stand? And then, can you walk from here to here? Okay. Can you do this, ma'am? Okay. You can now sit. So as I can see, my patient's gait is smooth and well coordinated. However, she looks uncomfortable. Her range of motion is smooth and well coordinated, and I don't see any involuntary movements. So after assessing the mobility, we are going to assess my patient's behavior. As I can see, my patient's facial expression is not appropriate for the situation. She looks uncomfortable. She is maintaining her eye contact from time to time. However, she stops the contact at some point. As I can see, she is not uncomfortable and she's not relaxed. However, her speech is uh, clear and understandable. For her grooming and clothing, I can see that my patient is well groomed and clean. Her clothing are clean, and it is appropriate for her age and culture. It is also appropriate for the climate and the situation. So after assessing for the behavior, we're going to assess my patient's pain. Ma'am, do you feel any pain in your body?
Yes.
Can you tell me, can you describe the feeling? Is it burning? Does it feel like it's prickling, or does it feel like it's cramping?
Cramping.
Okay. Do you know when did it start?
Yes. Earlier 1 p.m.
Okay. Can you specify what part of your abdomen?
Under my belly button.
This area?
Yes.
Okay. So, how long did it feel painful?
For at least 7 hours.
7 hours, okay. Do you, in a scale of 1 to 10, how can you rate your pain?
7.
7. Did you do anything to make it feel worse or less painful?
I used hot compress.
To relieve the pain?
Yes.
Okay. Are there any feeling, or are there any associated pain do you feel associated with your pain in the lower abdomen? Do you feel dizzy or nauseous, or did you vomit?
I feel weak and dizzy.
Okay. So after assessing the pain of the patient, we are going to assess for the height. So first, we will going to remove your outer clothing, outer clothing, and your shoes. So for the can you stand? For the assessment of the weight, we will be using a weighing scale. Can you stand here? Okay. So my patient's weight is 54 kilograms. So for the next assessment, we're going to assess your height. Can you stand over here? Okay. Okay, you may now be seated now. Okay, so my patient's height is 1.52 meters. So after that, we will be we will be comparing the previous weight and height. We will be comparing the present weight and height to the previous weight and height, and to the normal or recommended range of measurement. So after this, we will be computing for the BMI. So the BMI is equals to weight in kilograms over height in meters squared. So the result of the BMI is 23.37, which means that it is normal. Ma'am, your BMI is normal. It is 23.37. So yeah. So after this, we will be measuring the waist of the patient using a measuring tape. Can you stand down? So the site of measurement is at the level of the umbilicus. So So the length of her umbilicus is 77, which it can be equated to 30, almost 30.5, 30.25 inches. So after the waist measurement, we are going to measure the vital signs of the patient. Okay, can you move right here now? So we will be measuring your vital signs, your BP, to be specific. Okay, how about you move here? Ito ka na yun. Para mas mataas. Alam mo yun. Just wait for just for 1 minute now. Is it okay with you? So for the meantime, I'm going to get the thermometer. I'll just be preparing this. So for the temperature, can you put this thermometer? The center of the axle. So my patient's blood pressure is 100/70, which is normal. So we will be waiting for the temperature. So my patient's temperature is 36.5, which is normal. So after this, we are going to remove our PPE, remove our gloves, perform hand hygiene, and then we will proceed with the assessment and um, refer the survey to other healthcare professional as needed for further evaluation.